And what you'll notice is that internal sensitivity is going to turn down as she feels more taken care of and understood. And how does that
Yeah,
feel?
I can absolutely feel that. I even feel the little Godzilla protecting her from that right now.
That's
And
what we want.
it's making me feel less triggered by the noise that is still playing right now.
Welcome to The Solution Behind the Symptoms, a show where expert therapists and doctors help patients heal from chronic symptoms. My name is John Gasenica. I'm a therapist and a researcher, and I'm very proud to be hosting this show in partnership with the Association for the Treatment of Neuroplastic Symptoms. We have a great episode today. Therapist and chronic pain specialist Rachel Mooers is here to break down a therapy session with a patient who struggles with chronic pain and a debilitating sensitivity to sound. You'll hear this patient rewire her brain sensitivity so that she can get back to the joy and play that chronic symptoms have taken from her life. So let's meet my guest. All right, so joining me today is Rachel Mooers. She is a licensed marriage and family therapist, the founder of Mojave Wellness, and the clinical director of the Better Mind Center, where she specializes in helping people recover from chronic symptoms through a mind-body approach to healing. She combines approaches like pain reprocessing therapy, emotional awareness and expression therapy, and trauma-informed work to help people reconnect with safety and trust in their bodies. Rachel has a unique ability to help even the most serious and rationally minded patients get reconnected to lightness, ease, and play. Rachel, it's so nice to have you today.
Thank you, John. I'm so excited to be here with you.
Well, the patient that I have today, it's actually a patient that people have heard in a previous podcast. She came for both pain and she also has sensitivity issues. So she has a very intense sensitivity to sound. And a lot of our patients have sensitivities, whether it's getting triggered to emotional situations, sounds, tastes, smells. Why do you think in the chronic pain community, on top of pain, there's also issues with this type of sensitivity?
Such a good question. If we look at how pain is really just the alarm bell, that's just the way that the brain can sound the alarm. What is the context for a brain to need to sound that alarm? There's probably a high amount of threat going off. And if there's high threat, it's easy for lots of things to be coded or interpreted as threatening. And it adds kind of like how much we can handle to have a little bit less at the top. So lots of things can kind of fall in that space of too much or overwhelming or just not right when we're already kind of primed for things to not, for the alarm bell to be going off.
When I work with a patient like this, and as you'll see in a few moments, I typically work on some of the underlying causes of this sensitivity. So the stress that's going on in the background, some of the emotional issues. What I've found, and so many clinicians believe in this, is this kind of two-pronged approach where not only are you taking care of the underlying emotional stressors, but you're also reintroducing a sense of safety or lightness or play in the person's life. And it's the reason I invited you on today's episode is I feel like you have such a good ability to do that. If there's a person listening at home who has difficulty feeling lightness or play or joy, how do you go about getting patients to kind of reconnect with that in their life? And why is that important for this journey?
Yes. I think for anyone who's listening and kind of maybe has a little bit of a raised eyebrow or skepticism or even like a roll their eyes attitude of like, and maybe not. Maybe it's also like, I would love to feel that way, but it feels very far away. The first place I would go is validation. Like, yes, you're not feeling like that's either accessible right now or it's important right now. And that's okay. Uh, we don't, I don't think any person chooses to go at something so hard or to say, I don't have time to have fun. No one would pick that on their own. So when we are starting from a place of like, okay, that sounds really far away, or I don't know if that's possible for me, I look at the context as, well, what's going on for you where that does feel far away, or it does feel not important, or what is in the way of that for you? I think a lot of people would say the pain. The pain is in the way. The pain stops me from going to go to do this thing that I want, from spending time with my loved ones, my friends, my family. Like if this would go away, then I could list off the litany, like all the enjoyable activities that you would want to do. So I think that a big piece that I start with is psychoeducation about how the fear-pain cycle works and how avoidance of these activities is actually what reinforces that these activities are not safe for you. So if, for example, if someone's saying, oh, I would love to go to that concert, but I can't be in that loud noise, or I can't stand for that long, or, something like this. By not going to the show, their brain observes that. They see that because we didn't do it, then that means I can't do that. That idea, this was too much for me or wouldn't be good for me, is by observing our behavior, we didn't do it. The brain sees that avoidance, and it's like the stamp of approval on the appraisal of danger itself. I would start with that of, are there places where, because of fear of pain or fear of I can't handle that or something, the brain is getting the reinforcement and the message, these things are not safe for me. If we look at what we choose to do, the brain also gets that feedback of what we approach. So if I do go to this event that's fun for me, this concert, or to whatever that thing is, and the brain sees like, I can do that, that's where it gets the feedback. This is safe for me. I can do it. That's where you show yourself that it's possible. And this is what I like to name as the difference between like the safety reprisal, the top-down messages of safety. I'm telling myself this is a safe sensation. My body's not injured. I'm safe. Versus the showing yourself that you're safe. And how do we show ourselves? We show ourselves by doing, by having experiences, by going towards, so that the brain can see that I don't have to avoid this. I get to approach this thing, whatever it is. We're doing both the emotional work or whatever that addressing the underlying stuff work is. That's one side of it. The other side is starting to re-engage with things that kind of show your brain, I'm not in that threat state anymore. Safety can be accessible. Play can be accessible. Nothing helps you learn like play. Nothing lights up the brain like play. If I have to argue it and say, this is why this is useful, this is how you set up opportunities to learn, by being engaged with something, by being able to experiment and see, what's going to happen next? How can I handle this? Can I do it from a lens of safety rather than from a lens of threat? And the more we get to do that, the more we get that feedback of, oh, this is fun. So, if we're living a life where our world has gone so small because of pain or other uncomfortable sensations, the way we expand our life and our choices again is by showing what lights me up. What are the things that help me see that my world is bigger, can be bigger?
In my own personal recovery, this is probably the thing I neglected the most. And when I started re-engaging with play, it was probably the thing that had the biggest impact on my recovery speed. So I want to show you a clip of this patient, and you'll see like the work can be pretty intense and it can be pretty emotional. And I think it'll be fun to see clips like this and then just kind of reflect how we can get a patient like that to also play in between some of the more intense therapy work they're doing. So why don't we take a look at the clip? Are there any other things you wanted to talk about or any questions you had?
I think that what I sent you, the misophonia stuff, that I have extreme noise sensitivity, and it just feels to me that I'm going through life with the expectation that something is going to trigger me.
Yeah.
Like I can't leave the house without my AirPods, and I have a backup pair of AirPods, in my bag always. And I have noise canceling earbuds. And, it just feels like everywhere and anywhere could be a place where I could find myself in a trigger position. Like riding the metro, riding the bus, going to the library as I did today can be such a triggering experience for me, because if the very kind and sweet girl sitting in front of me is typing on her laptop a bit too loudly, it just sets me off. It puts me into this mode where I can't function. I have to leave. Or I have to turn the volume up so high in my AirPods and do background noise and do noise cancellation and do rain sounds and do like everything at once. Which is all like for my brain is not really tolerable either. Like so I think that going through life that way is just very stressful and very enabling that sort of pain-fear cycle, I guess. Like I'm always in fear, I guess.
What do you feel like when you hear that loud typing? What do you feel physically?
It's a fight or more flight response. Like I normally I just have to leave. I can't really fight it because I'm just too embarrassed. I would be so embarrassed to tell someone else to, can you please type differently?
Softer.
Because
Yeah.
that's just, you can't do that. So it's mostly this anxious feeling of having to get away as fast as I can because this is going to cause me pain, or this is just a threat. It's just this pure threat feeling. Typing is it's still okay. Like, it's mostly food related sounds like chewing, gum chewing, eating food with your mouth open. So like that, there every day I just get up and leave. I just can't. And it's happened to me many times that in restaurants or in social situations, I will just have to get up and leave and I can't explain myself. And yeah, it's just it's debilitating.
It sounds debilitating. Yeah.
Because even like my big fear right now is that when I will be doing my job as a physician, I won't just be able to get out of situations.
100%. Yeah, you'd be trapped, right?
Yeah. And that feeling of being trapped in a triggering noise-related situation is just one of the worst things that I can imagine myself being in.
So, like a lot of people, when I was in pain, I had this kind of central sensitization volume knob turned up in my system. It wasn't just the pain, it was kind of sensitivity to a lot of things. One of the things I was very sensitive to was just like my skin was very sensitive. So tags on my shirt, like all of my shirts, I ripped the tags out of. Noises would bother me. Have you had any of these situations where you felt very sensitive to a particular kind of like ick like that, where it just kind of like sets you on edge?
Think of itchiness for me. That's one, which is so funny because I was a competitive swimmer for so long and I was in the pool. I smelled like chlorine all the time. But it didn't bother me then. And then after that wasn't a normal thing. It's like any hint of that. And I was just like, can't do it. And I was just like, less tolerable, not tolerable.
Yeah, for people at home, this was a big part of my recovery because I was focused on my pain a lot, but there were little sensitivities I had. Like I'd be kind of constantly clearing my throat or cracking my neck or itching or shifting in my chair. And while it seems kind of benign, every time I was doing something like that, I was just communicating to my body that I wasn't safe. And so addressing these sensitivities can go a long way in terms of helping people's nervous systems calm down on a holistic level. Have you seen that in your patients when they address these things, or these type of things get turned down, the pain work gets easier?
Yes. I think that when we get to track through, what's the sensation avoidance cycle between you and this stuff, and people get a better understanding of how the threat message is building or it's getting added into what their experience is, that insight alone can be so useful, because if you don't know what's adding or what's building, like that can be really impactful in itself. I think that when you start finding what can I do instead to either soothe myself, tolerate this, give myself even though I'm uncomfortable, this is tolerable. People, when we start to I'm going to get up with this sensation, or I'm going to, let's dance. People find that they feel more empowered. And so if instead, like me and this sensation, I always have to get away, you get smaller and your world gets smaller and these things get bigger and bigger and scarier. So when we start being able to find, okay, how can I, one, tolerate that this isn't even if I'm uncomfortable, it's not dangerous. And then how can I start to find where I can be bigger than this thing, or feel better, or feel good in spite of this? It builds our sense of, I can handle stuff. My choices matter, and I get to choose how I respond to this. So empowering. And then because of the way you're squaring up with it, it completely starts to change. So when that happens, it builds this momentum a little bit. And then people find, I can do X and I didn't know that I could. And that's a pleasant surprise. And then I think it starts a kind of an upward spiral that applies to pain, that applies to all kinds of stuff we avoid, difficult conversations, all whatever is going on.
So what Rachel's describing is your relationship to the symptom itself. You could think of this as like half of the equation, is changing your fear to the symptom, changing your relationship to the symptom. What I'm going to show next is the other half of this equation, is actually kind of figuring out What's causing this nervous system disruption or this sensitivity in the first place that's causing the symptom to be so effective or so enhanced? So let's take a listen.
Younger, because I've had this since I was 4.
Mhm.
When I was younger, we tried rapid eye movement therapy, so EMDR. Yeah. And it never really helped me. Also, exposure therapy, that was actually making it worse. Then when I got a bit older and started reading papers on it, that actually made it worse as well, because all the papers said, no cure, nothing helps, take beta blockers. So then I felt very desperate. And right now, it's always having this safety blanket of having my AirPods with me, of having earbuds with me, that is giving me some reassurance that even though I get into situations where I can't get out, I would have this Band-Aid to put on it. Even if it doesn't resolve the situation, it could improve it slightly to just block it out.
So you have your soothing techniques right now. You have your
Yeah.
safety blankets. This is on the OCD spectrum. It's very similar to OCD symptoms. It's just like a different representation of it. That's this sensitivity, this kind of, think of like this internal volume knob that's been turned up for you, that you hear things more intensely.
Absolutely.
And so there's a couple models that explain this. One is the exposure model, which you've tried and hasn't worked. And when that happens, that means this is less about you tolerating uncertainty and more about finding the root cause of why is your brain so hyperfixated on these dangers.
Mm-hmm.
And so this is where we get to what we call like the hidden emotion model, which is when you're on a train and somebody's typing loud, your nervous system is very active and it's looking for danger. It's on the lookout for danger. And it's finding it in that noise.
Mm-hmm.
And it's absolutely appropriate for you to have your safety techniques, your AirPods. The trick is getting it to a place where it's tolerable enough where you can kind of sit there and you don't have to flee. So if that means putting enough noise on or putting enough kind of protection. And then the trick is asking your brain the question of, what are you scared about right now? What are you angry about? What are you sad about? And understanding that there's this noise is your brain's hypervigilant about something, and the noise is just a false flag for what it's bringing its attention to. It's a very good distraction. And so the reason this is helpful away from the exposure model is because with the exposure model, you're kind of like hyper-focusing on the sensation itself. With this, you're hyper-focusing on the danger, but it's not necessarily the sensation, and it brings your brain away from that.
That's very interesting. That's very, very interesting, because I actually know what my brain thinks is dangerous. I mean,
What is it?
it's that as a child, I was never allowed to do these noises, and I would be punished if I did them, because they're the exact noises that my dad he cannot hear them. And so it's just passed on to me. And it also has a lot to do with all of the anger that I have, because they're just copy paste onto me. And I have a few noises, for example, that aren't as triggering to me, but they still get my attention. And they're the ones that are very triggering to my father, for example. And I've started to use them to train myself to just tolerate them and tell myself that these noises are allowed to be there, because they're not. It has a lot to do with, you're not allowed to do that. You shouldn't do that. That's not respectful towards other people. This like table manners and like all of these principles that you should live by. And if you don't live by them, you're not a good person. You're not adequate.
Yeah.
And the fear of being inadequate is so big and so present and has been always. And so it sort of just translates through those noises.
100%. No wonder it's so triggering. You can see how an environment like that causes this hypervigilance that would amplify these sensations and make you on the lookout for them, incentivize your brain to be kind of hyper aware of them. And so we can see how that's affected her experience when these sensations come up. But we were talking a little bit before I pressed record about how a situation like this could affect your ability to feel pleasure and to have play. Like, how would an environment like that growing up, where it's very rule-based and it's very strict and it's very inappropriate to do things, how does that affect your lightness and your ability to enjoy and play?
It gets in the way. It puts rules. Those rules go on top of that natural ability that you have, that I have, that every person mammal has to play. So, and I would just emphasize that for a moment. If you see babies, if you see kittens and puppies and all sorts of, beings in this world when they're young, they know how to play. We don't have to make this this is an inherent human trait. This is how kids learn. That's why, kids get to say, go play, go. We know inherently that it's valuable. We know that it's good for kids to be able to do that. So first, that's so important. And I would just name that's really about learning, and that's a natural ability we all have. If we're having trouble with that, it's just that mess has gotten in the way, like for this person. So how does that happen? Most people know the safety danger framework around pain. I would say that that also applies to relationships and to connections. What I mean when I say that is connection means safety. Disconnection means danger. That's how it codes in a human nervous system. So if you and I are having a little joke back and forth, and then all of a sudden, John, your behavior changes and you turn away from me, or you give me this like disgusted look or something, before I even think about it, I'm going to go, what did I do? My brain will code that change between us, that I pick up on, that connection changing, as dangerous. And I will look at what happened that caused this disconnection. Humans need each other to survive. Our survival and our safety is built on our connectedness. We need each other at lots. I'll just say it that way. That's why, what's the worst thing we can do to a person? What's the worst punishment? Banishment. It's connection. That is very threatening to a human. Oh, if we know that, and we know that principle, then when a kid is being a kid and is playing and doing whatever kids do to play, which includes silly noises, which includes pushing the limits, which includes testing, where is my edges here? What can I do? What's fun? And that is met with criticism or a judgment correcting the behavior. There is disconnection embedded in that response. And so we learn this is dangerous. Play becomes dangerous. Me being myself becomes dangerous. This movement that I like to do, or this sound I like to make, or this what have you, whatever it is that we all naturally do, we start to learn that one is harmful to someone or makes it displeasing to someone. And that causes us to go, oh my gosh, that behavior, that thing that I did must not be safe, because disconnection that's not acceptable. So I'm going to have to figure out internally, what do I do about this so that I can maintain the connection?
Yeah, it makes sense. And what we want to do in this next clip is start showing the patient how to react to these situations, these discomforts, in a different emotional way that kind of starts rerouting the way their brain is handling these situations. So let's take a listen. Is there any noise you could put on right now that might be triggering that we could work with?
That is actually really, I mean, I would have to ask you to make the noise, because I only react to other people making noise. I could listen to a dog slurping and eating. I couldn't care less. But I could even eat disgustingly myself. I could not care less. But if someone else is doing it to me.
Can you watch like a video of a person slurping? Would that be triggering?
Oh yeah, that would be triggering. Yeah.
Yeah. Can we try that real quick?
Yeah.
I want to show you how to do that in practice. Can you pull up a video of somebody slurping?
YouTubing smacking sounds. Anyway, I'm gonna do slurping ASMR. This is gonna be so triggering. It's worse when it's a man, actually. I'm gonna look for something male, because these are all female, and I'm just gonna take this. Loading. All right. Should I go for it?
Yeah, just go for it. Maybe play like a few seconds of it and then just pause. So what did you notice when you played that clip in your body?
My whole body tightens, like instant, it's really instant. So my whole body tightens, and it feels so imminent. So I just have to get out of that situation any way I can.
Let's play the clip again, and I want to talk you through how to handle these situations. Describe to me what you're feeling.
It's this bubbling in my chest. It just feels, it's a mixture between fear and disgust.
The motivation here is to reconnect with this emotional piece of you.
Mm-hmm.
Connect with those sensations. See this as that little girl who's afraid and disgusted. And I want you to see if you can bring your attention to those sensations as much as you can. And just ask that piece of you, are you afraid right now? And what are you afraid of? And just see what comes up.
I think what really comes up is just fear of some sort of repercussion.
Mm-hmm.
That there's something is going to happen if this sound is allowed to exist and be there.
Perfect. And this is where I want you to shift to anger. Ask her, are you angry that you have to deal with this? Are you angry that you're worried about repercussions? Good.
Yeah, it
So
makes me so angry.
Use this as an opportunity to connect her. Just ask her, express yourself. I want to hear what you're angry about. And just let her go. What does she have to say? What is she angry about?
That she has to just deal with these intolerable situations that this fear is putting her in, and that she doesn't feel understood. No one understands that also these sounds could even be triggering, and so always having to explain herself, always having to manage also all the surrounding factors that are just linked to her not being able to deal with these sounds is just even more pressure, even more work for her to do. So it's not only the sounds and not being able to tolerate them, but everything else that is just linked to it as well.
And just keep on encouraging her to vent. And you're bringing your brain to actually what it needs to work on. The noise is irrelevant. It's just the trigger. What's important is how she feels right now, and feel this deep connection with her growing. View this as an opportunity to really reconnect with this girl, because this is what gets her talking. And you can pause the audio for a moment.
It's funny because I hadn't even it almost I didn't even really focus on it anymore. That has never happened to me in my life.
So in this clip, I'm trying to help the patient realize that the discomfort that comes from these noises is not necessarily the noise itself, but what it reminds the brain of. And she told us about this childhood where when these sensations or these noises were happening, her father would get very upset. And that little girl didn't have an opportunity to do anything but just kind of like cower in fear and hope the sensations went away. And so what I'm trying to help her do in this situation is have her tap into another emotion, like anger, something that little girl was never allowed to do, so that she can help show her brain there's other ways to react to these noises other than fear and disgust and wanting to run. Why do you think it helps to tap into these different emotions when we face triggering sensations? Why does that help the brain change our reaction?
Oh man, there's so many reasons. I think it helps show, well, if we name the response of just holding on and tightening and having to suffer through, what kind of feedback is a person are we getting about our abilities in a situation if that's our only choice? It teaches that this isn't safe, this situation isn't safe, my reactions aren't safe. And of course she got there because who knows what, I mean, we can guess, like if she would have gotten really upset and fought back, probably it wouldn't have gone well for her. And I think there's so much to say about the power dynamic there for this particular person. And I always want to look at power dynamics in situations like these. But so if we redirect to, well, what was going on for you? Besides that, if you could have spoken up, if you had more safety to do what you needed to do or what you felt was right, what you felt was important to name, that shows the choices available and you get to do it. You get to show yourself, I am angry and that's valuable. That's important. This situation is not okay. This is not mine. How dare you? Whatever that is, it's helping show that the inherent reaction that she has, her experience, is safe and is allowable.
With a patient like this, that word you bring up, allowable, is really interesting to me, because with a patient like that, in a previous episode, she talks about her pain came on because she was doing a lot of yoga, but it wasn't necessarily like this like super joyous, fun yoga. It was kind of like an intense yoga. It was like, I need to get stronger. I want to push myself type of yoga. And a lot of patients are kind of raised in these environments where they aren't allowed to just kind of feel joyousness. They aren't allowed to feel just like this lightness, regardless of the situation. If you have a patient like this, and I'm very much in this camp, like sometimes when I go golfing or surfing, I turn it into like a job, and by no means is anybody paying me to do these things, but I'm so want to get better and improve that I stop having fun. How do you help a patient like me or like this patient who kind of gravitates toward intense things, but not just kind of like fun or light things? What are the first couple steps you can do to kind of teach your brain you are allowed to go toward lightness again? You are allowed to do these things.
I think we have to show you. We have to show the person. It is one thing to say, cognitively in this intellectual discussion, yeah, it's good for you to relax. It's nice to not work so hard. Sure. People will look at you and they'll be like, mm-hmm. And you can just see how much they don't agree. Or they're like, that's not how the real world works. Insert slur, what I was going to say right here. So I think that we could make ourselves blue in the face talking about the science or the why it's good, and that will not land at all. I think if you show someone, let's play around a little bit. Let's do something silly. Let's suspend judgment for 5 minutes and make silly faces with me. When people allow themselves to do whatever that little activity, whatever that is, where they get to ease up a little bit on the competition, on the must get to, on the striving, on the working, they find this feels good. And that's, I think, what reconnects you with. That's why this is valuable. Feeling good is valuable. Pleasure is valuable. It's a human right, and it's good for us. When we feel good, our mood lifts, our energy comes back, our creativity and way of looking at the world as a opportunity rather than as one mine between another that we just have to get through. That's what changes. And so we have to feel that to really buy in. And then once you feel it in a little way, that's what gives us a little bit more buy-in to do more. So it feeds itself.
Well, let's get back to the clip and just see how this patient reacts to continuing to change her neural pathways in terms of these sensations. Your brain wants to distract itself with the sound because the emotion is too scary for it to deal with. And the moment you go toward the emotion and let it know it's okay, of course you're angry about this. Nobody understands you. You have to deal with the situation that you never asked for. This was put on you. And you feel this connection growing between you and your emotional piece. Your brain starts to realize, okay, this emotion's not that scary. I don't have to hyperfixate on these outside sensations. I don't have to feel so scared right now.
Mm-hmm.
And so let's try it one more time. I want you to just put it on one more time. Good. Allow her to get activated and think of this as an opportunity to reconnect with her. And just ask her, what are you angry about right now? Just see what she says.
Yeah, just having to deal with the incapability of withstanding these sounds and not even knowing why. And not understanding where it comes from and having to explain herself and just deal with the repercussions of it.
And have her get specific. What do you feel about your dad and his role in making you feel sensitized like this?
It just feels unjust.
Yeah.
It just really feels unjust. Like a burden that was just also carelessly given to me. And just, it feels like there was no regulation for any emotion whatsoever on his side. That also the noise sensitivity included. Everything was just passed on to me. And it just feels so unjust that almost feels like generational trauma just being passed
100%.
on to me. And
so just validate her anger. I want you to just imagine just talking to her and letting her know everything you just said is completely valid. And you have every right to feel this way. And just encourage her to just throw a tantrum. I want you to just imagine her screaming and throwing her limbs about. And just imagine protecting her and taking care of her and encouraging her to feel this. And what you'll notice is that internal sensitivity is going to turn down as she feels more taken care of and understood. And how does that feel?
I can absolutely feel that. I even feel the little Godzilla protecting her from that right now.
That's what we want.
It's making me feel less triggered by the noise that is still playing right now.
And so the further you go with this noise, the more comfortable you feel. And this is the experience we want your brain to have. And so you can pause it now. And how was that experience? And you can open your eyes.
It just feels so, it feels so close to what I feel with the pain.
Mm.
It feels so intertwined and connected because I felt like I was going through almost the same. I don't really know how to describe that, but it felt like I was reaching the same areas of my brain right there, the same pathways. Like it felt like going through the same procedure, just on a different area of sensation, I guess. One is hearing and the other is feeling. I mean, it just feels same, but different.
And if you can kind of approach this all with the same strategy, this is how you bring down that sensitivity kind of in all aspects of your life. And it's like how it feels holistic. It feels like this is not just pain work, but this is, yeah.
My mind is blown. Wow, thank you so much.
Well, let's pause there then.
Yeah.
So to kind of bring this full circle, the patient's realizing, okay, I want to treat my pain the same way I treat this sensitivity. And for a lot of people, it's also the same way we're going to treat this reluctance to feel joy and happiness, which is we want to go towards these things, and any discomfort that comes up, learn how to deal with that discomfort and use different emotions, different soothing strategies to handle it so we can go closer to these things that are good for us. If there's somebody at home listening right now who's saying, it's so difficult for me to feel joy, or even kind of more intensely, when I try to have fun, I just feel guilty and I feel like I'm not being productive. I get this kind of anxiety response. How would you guide that person back toward joy?
I think, again, I would refer back to what feedback is your brain getting from this decision that you're making. So if we feel like we want to do something fun and then we feel guilty and we say, so I'm not going to do it, you're teaching the brain that you should feel bad, that doing something fun is not good for you, you should be doing something else. So first, we would just want to say, what message are you sending to your brain very clearly so we know, is that the message you want to be sending? What message would you rather be sending? So we want to do that in that space. It's so funny because I was just having this conversation with someone about feeling guilty, and all of a sudden so much less pain, and she said that people in her life were responding to her like expecting her to be hurting more. And so she felt this kind of maybe I should be sitting in bed, maybe I should be suffering, like that's what I'm supposed to be doing here. And it's so wonderful for me, like getting to sit with people and be able to say, absolutely not. That we want to show you that you are safe. We want to show you that life can be pleasant again. You get to do what you enjoy again. And actually, that is the path where you teach yourself safety by doing something fun. And then afterwards, looking around and being like, it's okay. It's okay. It's actually good. And all the good feelings that come with, I allowed myself to have this. That is mine. That belongs to me. And that's a part of the gift of being alive and making it in this meat bag.
Well, Rachel, thank you so much for being here. I really appreciate your time.
It's so fun to get to talk with you about this, John, and get to pair the weight of the emotional work, because that work is challenging and people are very courageous to do this and to, come up against these things that they've felt and been afraid of for a long time. It is such a joy to kind of catch from there. Let's do some scaffolding on all the fun that you missed out on and start building that back in. It is my favorite piece. And I just love when I get to hear people, 5 months, 6 months, a year down the line saying, oh, I did this thing and it was so awesome. And you just hear it in their voices. Like you hear I loved that I got to do this, and I love cheering people on. And I think if I get to be the first person who gives permission to do that, I hope that people get to say, you know what? You're right. I do deserve this. I do get to go enjoy myself. I work hard enough in other categories that I get to have this too.
Well, speaking of leading by example, can you just share with people what you're running off to after we press stop on the record today?
Sure. After we finish this recording, I am going to go do one of my favorite activities since I was young, which is wear costumes. And I am going to go dance for 3 nights in a row at Electric Daisy Carnival.
I love it. Well, if you're listening at home and you need any excuse to go have fun, just follow Rachel's really, really good pathway. Thanks a lot, Rachel.
Thank you.
Thank you so much for listening to The Solution Behind the Symptoms. I'm going to give a huge thank you to Luca for sharing a piece of your journey. If you'd like to hear more about Rachel Mooers You can find her at the Better Mind Center or at mojaviwellness.com. And if you'd like to be a patient on a future episode, message me on Instagram at johng.therapy, where I answer questions and share tools from my practice. Thanks again.